Okay, picture this. You're in the ICU, first clinical rotation. Your patient, who seems stable with a basic infection, is suddenly crashing. Alarms are going off everywhere, their blood pressure's just tanking, and the whole team is scrambling. So what's really going on here? Well, it's not just the bug. It's the body's own immune system launching this massive, out-of-control counterattack. Understanding this response isn't just about passing the NCLEX. It's about seeing that silent war that's happening inside your patients every single day. All right, let's get into it.
So here's our game plan. First, we're going to meet the troops, your immune system's army. Then, we'll watch the first fight break out with local inflammation and see what happens when that little battle goes nuclear and turns into sepsis. After that, we'll cover the special tactics for fighting those invisible invaders, viruses, and then call in the elite forces of adaptive immunity. And to wrap it all up, we'll do a rapid-fire mission debrief to make sure all this stuff really sticks. Let's do it!
All right, so first things first, your immune system isn't just one big defense force. Nope, it's actually organized into two totally distinct branches, and they each have a completely different strategy for keeping you safe. Kind of like having beat cops on patrol and then a highly trained special ops team ready to be called in.
This slide breaks it down perfectly. On one side, you've got innate immunity. Think of these as your first responders. They're fast, they're furious, and they don't need to have seen a bad guy before to jump right into action. This is stuff like your skin and a whole bunch of cells that are just ready to fight anything that looks foreign. But here's the catch. They don't learn. They fight the same way every single time. Now on the other side, we have adaptive immunity. These are your special ops. They're a little slower to get going the first time, but they learn from every single fight. They create a memory of the enemy, so if that same bug shows up again, they launch an attack that is way faster and stronger. This is the system that gives you immunity.
So who are the actual players in this army? Let's meet the cast of characters. First up, we've got the intelligence gatherers, macrophage and dendritic cells. These guys patrol your tissues, and when they find an invader, they don't just eat it, which is called phagocytosis, they actually take a piece of the enemy and bring it back to headquarters to brief the special ops team. Next, the alarm sounders, mast cells. These guys are like little grenades packed with histamine, just waiting to go off the second something breaks through your defenses. Then you have the infantry, your neutrophils, eosinophils, and basophils. Millions of them are just circulating in your blood, waiting for the call to battle. We also have the innate assassins, natural killer cells. They're special hunters looking for your own cells that have gone rogue, either from a virus or cancer. And finally, the stars of the show, the special ops, T cells, who are the mission commanders and assassins, and B cells, which are literally weapons factories, just pumping out these super-specific antibodies.
Okay, quick pop quiz to see if you're with me. You're going to hear this term a lot. A B cell or a T cell is called naive when it... What do you think? Go ahead and pause here for a second. Really think about it. You got an answer?
The correct answer is B. A naive lymphocyte has not yet met the one specific pathogen it was designed to fight. It's fully grown, it's ready for action, but it's just never been on a mission before. It's just floating around waiting for its target. Once it finds it, boom, it gets activated and it's not naive anymore. You totally got that.
So let's paint a picture. Imagine you get a little cut, maybe from a splinter. That's not just a wound, it's a full-on security breach. All the germs on that splinter just waltzed right past your main defenses and are now inside your body. This triggers an immediate, localized code red. This is inflammation.
So here's how it goes down. Step 1. The breach is detected by those guards we talked about, the macrophages and mast cells. Step 2. They immediately sound the alarm by releasing chemical messengers like histamine and these things called cytokines. Now, cytokines are super important. Just think of them as the text messages the immune cells send to each other to coordinate the attack. These signals then trigger step 3, the vascular response. Blood vessels in the area get wider and their walls get leaky. This is exactly why a cut gets red, warm, and swollen. It's just a traffic jam of extra blood and fluid rushing to the scene. Finally, step 4, those cytokines act like a flare in the sky, calling in the infantry. Neutrophils in your blood follow that chemical signal, squeeze through the leaky vessel walls, and boom, they're at the battle site, ready to fight. It's a really amazing coordinated attack. But what happens when that little local fight isn't enough? What if the invaders are just too strong and they break through the local defenses and spill into the bloodstream? Well, that's when the battle goes from a small skirmish to a full-scale, nationwide war. This is what we call a systemic inflammatory response. And this systemic response has a specific name, the acute phase response. It gets triggered when the concentration of those cytokine text messages gets so high that they're basically screaming all over the body through the bloodstream. And there are 3 masterminds here, interleukin-1,
interleukin-6, and tumor necrosis factor alpha. When these three hit the circulation in big numbers, they're the reason you get all those classic, crummy symptoms that make you feel sick all over.
This table is absolute gold for connecting what's happening inside the body to what your patient is actually feeling. So those three cytokines, they travel up to the brain and tell the hypothalamus, your body's thermostat, to crank up the heat. That's your fever. It actually helps slow the bad guys down. They also cause that sickness behavior. You know, that deep fatigue that just makes you want to lie down and do nothing? That's on purpose. It's to conserve energy. They signal the bone marrow to start pumping out more white blood cells. That's leukocytosis on your lab report. They tell the liver to make inflammatory markers like C-reactive protein. And get this, they tell your fat and muscles to break themselves down for energy. So when you feel those deep body aches, that's literally your body cannibalizing itself for fuel to fight the war. Pretty wild, right?
Okay, listen up. NCLEX alert. This is a guaranteed high-priority topic because when this acute phase response goes into absolute overdrive, it can lead to one of the scariest things you'll see in a hospital: sepsis.
Here is your test day strategy. If you see a question that mentions a gram-negative bacterial infection, your brain needs to immediately scream, high risk for sepsis. Why? Well, their cell walls have something called lipopolysaccharide, or LPS. It's a super powerful endotoxin. When LPS gets into the bloodstream, it's like a bomb goes off. It triggers this insane release of TNF-alpha, causing sudden, widespread vasodilation. Every blood vessel in the body just opens up and gets leaky all at once. This causes a catastrophic drop in blood pressure. That's septic shock. And in the absolute worst cases, it can trigger something called DIC, disseminated intravascular coagulation. The body throws tiny clots everywhere, using up all its clotting factors, and then, paradoxically, the patient starts bleeding from everywhere. It's a complete disaster, and it's all driven by the immune response itself.
All right, let's switch gears a bit. So bacteria are one thing. They usually live outside our cells. But viruses? Viruses are different. They're like these tiny little spies that sneak into our own cells and turn them into virus-making factories. So how in the world does your immune system fight an enemy it can't even see, an enemy that's hiding inside its own people? Well, it takes a whole different set of rules.
So the response has to start from inside the infected cell. A cell knows it's been hijacked when it finds double-stranded RNA, which is a huge red flag because our own RNA is always single-stranded. As soon as it senses this, it sounds a special alarm called interferon. And interferons pretty much do what their name says. They interfere with viruses. They do two really important things. First, they warn all the neighboring cells to go into lockdown and start making enzymes that will chop up any viral RNA that tries to get in. And second, they tell the infected cell to raise a red flag on its own surface, basically shouting, "Hey, I'm compromised over here. I'm a traitor." This red flag is what calls in those innate assassins, the natural killer cells, to come and destroy the infected cell before it can release a new army of viruses.
Okay, time for another quick quiz to lock this concept in. What exactly is that red flag? What's the specific molecule on the cell surface that holds up a piece of the virus for everyone to see? Go ahead and pause here. Think about it for a sec. The answer is MHC class 1 molecules. The best way to think of it is like a little display case on the cell's surface. See, every single cell in your body has these MHCI molecules, and normally they just show off little pieces of your own self-proteins, telling the immune system, hey, I'm a healthy cell, nothing to see here. But when a virus gets in, the cell starts putting pieces of the virus, the antigen, into that display case instead. That's the red flag that tells NK cells and the adaptive CD8 T cells, this cell has been compromised, take it out. You're doing great.
So, we've seen the innate system's raw power and its clever antiviral tricks. But you might have noticed that in both cases, the innate system eventually needs to call for backup from the big guns. And this is where we bring in the special ops. The adaptive immune system is where the real intelligence and long-term planning happens. This is the system that learns the enemy, designs a custom-made weapon, and then remembers that enemy for the rest of your life.
So how does the brute force innate system report back to the super smart adaptive system? It's through these guys, the antigen-presenting cells, or APCs. After a macrophage eats a bad guy, it doesn't just digest it. It takes a piece of that pathogen, the antigen, and puts it on its surface. Then it travels to a lymph node to show this piece of intel to the commander of the whole adaptive response, the CD4 helper T cell. And that presentation, that's the critical handshake that activates the entire adaptive army.
This is such a great way to understand how the adaptive system finds the perfect weapon for the job. You're born with this huge library of millions of different B and T cells. Each one has a totally unique receptor, a unique key. So when an APC shows up with a new antigen, the body frantically searches through that entire library for the one single B cell and T cell whose key happens to fit that specific antigen lock. This is called clonal selection. And once it finds that perfect match, it triggers clonal expansion. It literally builds a factory to mass-produce millions and millions of copies of that perfect key. Some of those copies go fight the infection right now, and others become memory cells, which are the key to lifelong immunity.
So once the right B cell is activated, it turns into a plasma cell and just starts cranking out antibodies. But not all antibodies are created equal. Let's check out the arsenal. IgM is the first one on the scene. It's a big molecule, and it's great at activating something called the complement system, which basically punches holes in bacteria. So, if you see high IgM, it means you're dealing with an active, acute infection. Then there's IgG. This is the memory antibody. It's smaller, more precise, and it totally dominates the second time you get sick. High IgG means a past infection or vaccination. It's also the only one that can cross the placenta to protect a baby. Then you've got IgA, which is the guard in your saliva and tears, and IgE, which is famous for allergies. But for your tests, the most important thing to know is that IgM and IgG tell you about the timing of an infection.
And this chart right here shows why that memory is so powerful. Look at the first exposure. There's a delay while your body is finding the right B cell. Then you get this little wave of IgM, followed by a slower wave of IgG. This whole time, you feel sick. But now, look at the second exposure. Because you have those memory cells, the response is almost instant. There's this massive, rapid surge of super effective IgG antibodies. Your body does something called class switching. It just goes straight to making the best antibody, IgG. And it also does affinity maturation, which means the antibodies it makes the second time are an even better fit for the target. This whole process neutralizes the bug so fast you probably don't even know you were exposed. That is immunity. That is how vaccines work.
Okay, let's lock in one more critical NCLEX alert. You will 100% be asked to interpret lab results based on this exact principle. So let's make it super simple.
Here's your cheat code for exams. If you see high IgM on a lab report, I want you to think M for miserable. The patient is currently sick. This is the acute primary response. If you see high IgG but pretty much no IgM, think G for gone. The infection is gone and the patient has immunity, either from getting sick before or from a vaccine. That simple trick will get you the right answer every single time.
All right, you made it through the whole mission. Now let's do a quick rapid-fire review to make sure all the most important intel is locked and loaded in your brain for test day. I'll ask the question, you think of the answer, then I'll say it. You ready? Let's go.
Question 1. What are those 3 key cytokines that take an infection systemic and make you feel sick all over?
That's IL-1, IL-6, and TNF-alpha. Got it.
Question 2. What's the specific part of gram-negative bacteria that's a huge trigger for septic shock?
Lipopolysaccharide, or LPS. That's the one.
Question 3. Which antibody screams, "This is an acute infection"?
IgM. M for miserable. Perfect.
And last one, who are the 3 intelligence officers that brief the helper T cells to kick off the adaptive response?
Macrophages, dendritic cells, and B cells. You totally nailed it.
And here's one last thought to take with you. In chronic diseases like rheumatoid arthritis or inflammatory bowel disease, the inflammation just never shuts off. The immune system gets stuck in this loop of frustrated repair, where it's trying to heal tissue and attack it at the exact same time. Now that you understand the soldiers, the signals, and the strategies of this whole battlefield, how does that change the way you think about managing those lifelong conditions? You did an incredible job today. Keep asking these questions, keep connecting the dots, and you are going to be an absolutely amazing nurse. Well done.